Welcome to RTV News. I'm Jane Mutoni. The RPF Inhotanyi Party has congratulated the Communist Party of China on the occasion of its 100th anniversary and assured it of cooperation in efforts for the development of the people of both Rwanda and the People's Republic of China. The Minister of Finance and Economic Planning, Dr. Uzien Ndagijimana, on Tuesday addressed the Parliament explaining the losses in RSSB and the Rwanda Printing Company. The news in details. The RPF Inhotanyi Party has congratulated the Communist Party of China on the occasion of its 100th anniversary and assured it of cooperation in efforts for the development of the people of both Rwanda and the People's Republic of China. Now, this announcement was made during a political parties summit convened by the CPC. Serge Nore has more on this report.
The Communist Party of China.
The virtual political parties summit saw the participation of around 600 parties from 170 countries and was held on the centennial of the Communist Party of China. Addressing participants, Francois Ngarambe, who is the Secretary General of the RPF Inhotanyi Party, congratulated the PCP on marking its 100th anniversary, saying, and I quote, "In our world that has become a global village, the interconnections between our peoples are cumulative due to numerous cross-cutting factors. It therefore calls us all to advance international cooperation for the sustainable development of our countries. Our respective political parties should play the central role in ensuring that this cooperation takes place. Excellencies, ladies and gentlemen, the Rwanda Patriotic Front attaches great importance to the pro-people-centeredness ideology as a vital leadership principle to develop the people's well-being. It is a strong foundation on which sustainable social-economic development takes place. I therefore wish to thank you as well for choosing a matching theme to our shared leadership value and principles." End of quote. The President of the People's Republic of China, His Excellency Xi Jinping, who is also the chairman of the Communist Party of China, thanked all who participated in the summit, saying the COVID-19 pandemic has reminded all nations that they need each other and that China will never try to dictate policies to other countries.
Democracy is the right of all peoples, rather than an exclusive privilege of the few. There are multiple ways and means to realize democracy instead of a single stereotype. The judgment on whether a country is democratic or not should be made by their own people, not by the handful of others. The CPC stands ready to continue to work with world political parties to stand on the right side of history and the progressive side of mankind. Let's make greater contributions to the building of a community with a shared future for mankind and a better world.
The summit was held under the theme, "For the People's Well-Being, the Responsibility of Political Parties."
The Minister of Finance and Economic Planning, Dr. Uzien Ndagijimana, on Tuesday addressed the Parliament explaining the losses in RSSB, the Rwanda Printing and the Rwanda Printing Company. Gloria Mutesi has more on this report.
Dr. Uzien Ndagijimana, the Minister of Finance and Economic Planning, commented on the long-standing issues in accounting and investment within the Rwanda Social Security Board, as well as the issues raised in the management and operation of the Rwanda Printing Company. On the issue of RSSB, Minister Uzien Ndagijimana said that it was due to the merger of 4 institutions, including the former Rwanda Health Insurance Fund, the Retirement Fund, and others. Responding to the questions from the members of parliament, the minister said that despite the shortcomings in RSSB, it is able to cover any losses incurred. Looking at the future, we see that RSSB is making good profit because looking at the past 3 years, between 2017 and 2019, with all the institutions combined together, the profit was 132 billion. And in 2018 to 2019, it was 117 billion, while 2019 to 2020, the profit was over 230 billion, proving that RSSB's capability is growing. As for the problems at the Rwanda Printery Company, an audit by the Auditor General has shown that since its inception, there has been no official document outlining its responsibilities with a clear understanding of its responsibilities and functioning. The minister on this note said that there were some reforms underway which will produce tangible results. The strategies to improve the functioning and development of the RPC include the establishment of a marketing department, the empowerment of the production department and recruitment of qualified and knowledgeable staff, and trainings, as well as expanding the capacity of the company to buy modern machinery and revise the board of directors, especially those with the knowledge and experience needed in the process. 62 members of parliament followed the address virtually.
A cross-section of people seeking services from hospitals asked for more strict measures for COVID-19, citing that there are some hospitals that don't have separate waiting areas for people that go for COVID-19 testing services and those seeking other services which might be ground for spreading the virus.
Caregivers and other people seeking services from hospitals and health centers say that the new measures that were put in place to fight the spread of the pandemic are limiting because visitors to patients are required to have done a COVID-19 test prior to the visit. As a caretaker, you have to stay out and the patient is inside. Whatever you plan to do, you have to first wash your hands. And for the people that bring us food, they stay out and call us to go get whatever they've brought us with precaution. We wear our face masks and practice social distance so that we don't risk getting infected or infecting others. And we also utilize the hand washing stations. However, in other hospitals, people that come for COVID-19 testing services are triaged at the same place with those seeking other services, which is raising concerns for the people seeking these services. We are concerned because some people who come to test for COVID-19 sit in the same place with those that come to get other services before they are tested or before they get the results. And if by any chance they are infected and not wearing the face mask properly, there are high chances of getting infected without knowing. Hospital and health center administrators say they've stepped up efforts to prevent the spread of the pandemic. And these include restricting the visitors that come into hospitals and restricting movements of the caretakers in the hospitals. If someone that has come for testing stays with a COVID-19 positive patient, we receive them separately in a specific area that is designated just for that, so that they are not in contact with other people who have come for other services, to avoid the risk of transmission. We have the youth volunteers to assist us in this, who also remind them of the importance of social distancing. There are hand washing stations at the entrance where everyone has to first wash their hands. And once they get to the reception, we separate those who have symptoms and encourage social distancing and wearing their face masks appropriately. And we isolate those that we find positive. Several health centers and government hospitals and private hospitals across the country offer COVID-19 testing services in a bid to make these services more accessible.
Residents and those that work in Kigali City say they understand the importance for testing for the COVID-19 virus, as it is one of the ways to mitigate its spread. However, they complain that the prices for COVID-19 tests are still high. Some private and public sector employees say they are required to take a COVID-19 test multiple times at the cost of the company they work for, or are required to pay for it. There are also those who choose to get tested out of their own will for self-awareness, something that health experts say is a good mindset. However, lately many are being required to get tested and pay for it. For example, those working in Kigali City in the Kimirongo market. They told us that we can only enter the market if we show evidence that we've been tested for COVID-19 virus. And so yesterday I went to get tested and I was tested negative. Then afterwards I went to the market and presented the RBC message, and that's when I was allowed to come in and work. Those working in and around the market have been asked to get tested because of the high levels of infection in the area, and they have all gladly went to get tested as they believe it is essential for their own good. I believe it is a good thing to get tested because once one is tested positive, he or she is then treated, hence avoiding the spread. Vendors at the market say they have been warned by health authorities that the market risks to be shut down as there have been high levels of infection in that area. Hence, all the vendors are being required to get tested in order to assess and come up with other solutions. We ourselves requested for the other option of getting tested instead of closing the market so that those that are tested positive can be quarantined and those that are tested negative can come back to work as we strictly adhere to the COVID-19 preventive measures as opposed to shutting down the market. The executive secretary of the Kimirongo sector, Umuhoza Rwabukumba, says the cost of a COVID-19 test is a real concern, but requests people to cope and know their status. Since yesterday, we've been encouraging them to get tested, whereby those who can afford the price will pay for it, and those who are not able to pay but have the health insurance, also known as mituel, can go to health centers, and those that don't have it and require urgent testing, we are looking for sponsors to fund them such that everyone gets tested. The government is urging the private sector to take part in combating the COVID-19 pandemic. Currently, a COVID-19 test known as PCR costs $50, which is equivalent to 47,000 Rwandan francs, while rapid test costs 10,000 Rwandan francs. This is not the first time that a high price for COVID-19 testing has been mentioned, and there are reports that the fee will be reduced. Residents say low-quality mosquito nets are the main cause of the increase in malaria. Now, the malaria division manager at the Rwanda Biomedical Center has announced an increase in the number of mosquito nets being provided, including advocacy for their effective use. Mwali Jed has more of the details.
Some residents say the mosquito nets are old and they have no replacement to keep them from contracting malaria. I have gotten used to sleeping in supernet. There are times it is placed above the bed and securely closed so that mosquitoes may not enter. I carefully open the net and enter bed so that mosquitoes may not enter and give me malaria. Malaria has increased this time. When they used to spray repellent, the mosquitoes had reduced, but this time they have increased. At least, we have these new mosquito nets, and we shall put them to good use. There are those that say mosquito nets disturb them as they sleep, and they choose to use other forms, such as mosquito repellent, while there are others who fail to find substitutes. I buy the repellent, and when it runs out, I buy another. Why would I need to use a mosquito net? It is also hotter these days. The supernet got old. I decided to remove it and put it down. We requested for some more, but they have not arrived. They do not provide mosquito nets to young people. I last remember receiving one when I stayed with my parents. Health centers confirm that during the months of May, June, and July is the breeding season for mosquitoes, which is considered to be the cause of the increase in the number of malaria patients. During the breeding season, we see an increase in mosquitoes. Where it lays eggs is where they mature and bite people. We now see around 4 people at a time, while we only used to see 1 or 2 people at a time. A survey completed by the Rwanda Demographic and Health Survey, DHS, in 2020 showed that mosquito net use had declined from 83% in 2013 to 2014 to 66% in 2019 to 2020. The division manager for malaria, neglected tropical diseases and other parasitic diseases division at the Rwanda Biomedical Center explains that the reduction is based on the timing of the study. He added that mosquito nets continued to be provided and the campaign for those in need continues. The last survey was submitted in 2017, and the others were submitted in 2019 to 2020. The research was not made available to the public, as they were submitted in 2020 during the 2nd and 6th month. We now confirm that the number has increased because we have given about 6 million nets for use. We are aware of those that do not use mosquito nets properly, and we are campaigning to solve the issue. For those that have problems with mosquito nets tearing, there will be more provided that will be available to be bought. Mosquito nets are usually delivered every 3 years, according to the number of people in a given household, so that at least 2 people share the mosquito nets. Mosquito nets are also provided to expectant mothers, as well as mothers with 1-year-olds. Umngari Jade, RTV News.
Well, there you have it. On behalf of the entire news production team, thank you for staying with us. I'm Jane Mutoni. Bye for now.